Hi, welcome to The Wire. My name is Banjot Kaur and I am a health reporter here. The Israel-Gaza conflict started on October 7, almost a month ago now, and close to 10,000 people have been killed. Today I have with me Ms. Farhat Mantoo, who is Executive Director of MSF South Asia and is also a member of the core global leadership team, which is closely monitoring the relief work going on in Gaza. I also understand that Farhat has been speaking to her colleagues working in Gaza. But before I get her talking on the important issues, there is an important and interesting snippet to share. According to Britannica, gauze is a light, open weave fabric used for surgical dressings, among other things. And the name gauze is derived from none other than the Palestinian city of Gaza, where, according to Britannica, this fiber originated. And today, Gaza, which is the birthland of this fabric called gauze, which is used to heal the wounded, is itself wounded like never before. And today Gaza is facing shortage of many a surgical equipment, perhaps gauze too. Welcome to the show, Farhat.
Thank you.
As I said in my opening remarks, various data sources indicate that close to 10,000 people have been killed, of which more than half are women and children. Since you have been closely interacting with your colleagues working in Gaza and you are also part of the important team which is monitoring the management of the aid on behalf of MSF there, what are your latest statistics as of now on the number of people killed and their gender and age-wise classification?
We have been relying on the Palestinian Health Authority's data, and like you alluded to that in the very introduction, that we are seeing numbers which are more than 9,700 dead. And what is more important, because you asked me the demographics of the dead and the injured. So what we hear is that as per UN OCHA, more than 62%, and the statistics are changing by the day, and that's one of the key challenges we have. So between 62 and 73% of the dead are children, women or elderly. So that is the group that is more impacted. And in terms of, we also have another category coming up is the missing category, which is they're quoted somewhere around 2,000 to 2,400 people are missing, and half of them are assumed to be children. So still under the rubbles, we do not know when we will have more information about their names and so. Another one is the number of injured. At a time when the health facilities in Gaza are under extreme strain, and they are not under extreme strain because of the already existing siege of fuel, water, electricity, essential supplies, but it's also the strain that is coming with the non-stop bombardment and the non-stop inflow of patients into the hospital.
Right.
So mainly trauma patients, mainly burn victims, some burn victims to the percentage of 90%. And in a regular hospital setting, one could understand what it means. The amount of precaution, care you need to take for burn victims, vis-a-vis the health facilities which are already overflowing. 40% of the health facilities are non-functional.
Yeah.
So a bed which would ideally occupy one person, it's like they have threefold patients plus patients lying on the floor. That is what our team is reporting on the ground.
Right. We have witnessed many a conflict in recent histories. And MSF has also been active in providing humanitarian aid in many of these conflicts. Can you recount any such conflict in the recent past where an elected government, we may hear that, two militia groups or one militia group and a government are in conflict, but here is an elected government which is supposedly targeting hospitals, perhaps at a scale that we haven't heard in the recent history. So can you recount any such conflict before where healthcare facilities have been targeted to this extent by an elected government?
In our 51 years of existence, unfortunately, this is not the first time. but what I can definitely ascertain is that this time it is at a level never seen before. So if you look past our history, the most recent I would quote is as old as just a month old in Sudan, where we had to close one of our hospitals because we could not have any more access to that hospital from a supplies point of view. Talk about Ukraine. Since last year, November, in the eastern Ukraine, Kherson area, the region that is there, we had now twice to vacate the hospital and try to evacuate our patients to some sort of safety because the hospital was constantly being bombarded. Talk about Yemen. That has been another context where ambulances and hospitals and health facilities have been attacked. The most glaring in recent past has been 2015 in Kunduz, where our hospital was a trauma hospital which was attacked and bombed by a US airstrike, wherein we lost more than 48 patients and staff members. So from a point of view that, is it something unheard of? No, it's not something unheard of. But what is different this time is that this is not stopping. Despite our appeal of immediate ceasefire, despite UN calling for a resolution of a humanitarian truce, which may be as weak as we all seen in terms of implementation because there is no respite from that. But what is more important is that we have seen it.
So that is what I was trying to understand. All these attacks or the incidents of attacks that you just recounted for us, do you see any comparability between those attacks and what is happening right now, maybe in terms of scale or any other indicators?
What we see in the current context in Gaza is that there is no distinction between civilian and non-civilian assets. When I talk about it, what does it mean? We have had our staff witnessing with their eyes attack on hospitals, attack on ambulances. Their homes have been destroyed. Some of them have reported the schools they were kind of taking shelter in, or the mosques or the churches. All of them have been part of this indiscriminate bombing. So that protection of health facilities, health workers, frontline workers, humanitarian workers, ambulances, there is complete disregard for that. That is something we have, this is something that speaks out loudly of this context.
How often do you see in these conflicts things like ambulances being attacked? Now we have reports from at least, I think, 4 hospitals where ambulances have been attacked. How often do we see these in conflicts where an elected government, of not any other nation but an important nation on the world map, has attacked, things like ambulances?
There is an increasing trend that we are observing around the world in places where we operate. I gave you example of Ukraine, I gave you example of Yemen, I gave you example of Syria, I gave you example of Sudan. But this time definitely we would say the intensity is much more. And
is this the intensity never seen before? Something like never seen before?
I would say to a certain extent, yes. Because what is different is, like in other places we had a breather where we would offer and bring some humanitarian corridors that would open for us, and we would bring in our teams, relieve our exhausted teams and rotate our teams, bring in supplies, try to find safety. I've been calling out loud, there is nowhere safe to go in Gaza.
Right.
Because here we are talking about all the context I defined.
Right.
People have a possibility to go out and seek safety somewhere.
Yeah.
But here we are talking about a piece of land which is not more than 365 square kilometer. We're talking about all the entry and exit points closed. How do you, in this stretch of land, which is, if you take a drive, we are talking about 25 kilometers, sorry, 25 miles. How are you going to seek safety? Because it's no one part of Gaza is left. It was earlier northern part. Now we have heard bombings being reported from the southern and the central part of Gaza also.
So the entire Gaza is being bombed at this moment.
Yes.
Right. As far as these ambulances attack, are concerned, it has been, I think, more than a day now. Uh, have you been able to gather anything from your colleagues on these attacks, particularly how many patients have been killed, or how many healthcare workers have been killed in these ambulances attacks?
Just immediately after we heard about this incident, we immediately got in touch with our teams to know about their safety, to know about their whereabouts. So we had one of our MSF doctor who was standing inside the hospital gate when the ambulance was directly hit in front of him. So as per him, the account was there were bloody bodies everywhere. Many were killed immediately, while we rushed others to the operating room for emergency care. The deadly attack outside the gate of Al-Shifa hospital impacting an ambulance is nothing less than horrendous. This is a lethal attack outside Gaza's main and busiest hospital. Mind you, Al-Shifa hospital is the biggest health facility, which is meant to cater to 750 bedded facility at one point of time. We are talking about, at this point of time, more than 2,500 patients there. And the hospital, unfortunately, is also being used as a shelter because everybody believes, and that is where it gets really tough. Everybody believes that health facilities, hospitals are meant to be a safe place. So from that point of view, a lot of elderly people, women, children have sought refuge in the hospital.
So do we have any numbers as to how many people have been killed in these attacks on ambulances, or is it still too early for you to kind of gather this?
No, we do not have, we do not actually kind of account for the numbers, and we rely on the numbers that come from UN, WHO and Palestinian health authorities.
Okay. So if you can say, which are the, I believe there are 4 hospitals where ambulances were hit. Is this correct?
Yeah.
So apart from Al-Shifa, the ambulances were hit at 3 more hospitals.
Actually, yes, that is what our teams have witnessed. But we also have seen that while carrying patients, while bringing in injured, they still have been a point of target. And it's not today. Gaza has been a place which has been under a blockade since last 16 years. And there have been many, many escalations in the past where we have seen that ambulances have been hit.
So you're saying that ambulances have been hit in the past too?
Yes.
This is not the first time that we are seeing.
This is not the first time. So specifically about Al-Shifa hospital, the ambulance that was hit was actually taking critical patients towards the south. So that
from north to south?
Yes, so that they could probably, if they would have a chance, they could get access to better health care outside Gaza if they could negotiate access through the Rafah border.
So this was in an earlier conflict?
Yes.
So while
in this conflict.
In this very conflict.
Yeah,
so when the patients were being taken from the northern part to the southern part, and that ambulance was hit?
Yeah, this is the ambulance that was hit.
Right.
Including the patients.
And you're saying that these ambulances have been hit by, the bombings in earlier conflicts too in Gaza.
Yes.
So this is, I mean, a bit strange thing, because if I may use the word habit of, the perpetrator of injustice to keep on hitting ambulances, why didn't it make so much noise before? I mean, I'm a bit surprised at perhaps my own self also, but ambulances being hit is perhaps the worst form of, attack that you can do on someone. So for some reasons, it perhaps didn't make enough noise before.
Manjot, if you look at around the world, wherever there are conflicts, unfortunately, health actors, health activities, health facilities.
No, I'm particularly talking about Gaza.
They have been unfortunately targeted by all sides of the conflict, which is an unfortunate reality. And for humanitarian organizations like this, we have been asking all the parties for respect and regard for international humanitarian law.
Right.
For respect and regard for the patients, because every patient has a right to access to health care.
That's right. The main cancer hospital has stopped functioning, and obviously there are a good number of patients who are suffering from various forms of cancer. More than, I think, as you also said, more than 2/3 of the other healthcare facilities have also stopped functioning. The remaining ones, what is your assessment? that the remaining ones can function in whatever capacity and role they are functioning right now? For how long will they function if this conflict continues?
It's very difficult to speculate how long, but I can already confirm that every health facility is being impacted, some to a very large extent, which has rendered them completely dysfunctional because of lack of supplies, because of being a target of airstrikes, because of no fuel, no electricity.
Yeah.
And the hospital you spoke about is the only public hospital that takes care of cancer patients. We are quite focused, and rightly so, in a conflict. A lot of attention goes to trauma and burn victims, but the regular life, what happens to all the other patients, what happens to patients who are having other non-communicable diseases, cardiac patients, hypertensive patients, insulin dependent diabetic patients, or dialysis patients. So that's why I've been kind of really emphasizing that while we talk about the trauma, we forget that in this situation we are also talking about women who need access to safe delivery. Neonatals need care and attention. The ones who are in ICUs on ventilators, they deserve a chance to survive. And if there is no electricity, how are we going to expect that ventilators and ICUs will stay functional? Dialysis machines will work.
Right. So I understand. I mean, it's very difficult to speculate or plan, and I believe it is one day at a time for all the healthcare workers there and healthcare facilities functioning there. So how does it happen? Do the workers or the healthcare workers there do a day-to-day planning, hour-to-hour planning, or how does it happen there? Or are you in a situation that you really can't make any sort of assessment even for a day?
So, see the dilemma. You have a health professional who is part of the community, making a choice between doing your duty of saving lives and doing your medical act in the hospital, and also not knowing how your own family is. Do they have a place of safety? We had staff reporting losing their homes, their families displaced, some families missing. In that context, the call for duty and the dilemma to look at your family and seek their safety. And it's not only safety, it's about clean drinking water. For your basic needs, it's survival, whether the other bomb is going to come and hit me.
So like that is, of course, very, very important part of human resource. But no, I'm only thinking for if I'm a hospital manager at, say, Al-Shifa or any other hospital, how would I plan my day? I mean, you cannot know how many injured will come. You do not know whether hospital will be bombed. So how do we, or we are in a situation that we really can't assess? We just have to go by as the situation, develops.
So as a medical professional, I think the most trying thing for a medical professional is knowing that they could save a life, but they cannot save the life because there is no required supplies they need. I think the moral distress that it causes to medical professionals, that they have patients in front of them who they potentially could save, but cannot save because the supplies are rationed. Gaza, it's not that before October 7th things were hunky-dory and they were nice. Also around that time, the supplies that were being sent to Gaza were very rationed as per the population. So it was not that they had big stocks there. As MSF, what we had is like we had stocks on the ground. But the stocks that were meant for 3 weeks were finished in 3 days. So imagine the flow of patients we were talking about. With every day, it's about just saving lives, just keeping bare minimum and trying to keep people alive. We are not even talking about post-surgical care. We are not talking about infection. Imagine in a hospital, what would you think about? Infection prevention control is the key. When you are doing surgeries on the floor, what happens to infections? So there you go. So from a point of view, it's about trying to save as many people as you can
without actually being able to do any assessment as to what you would be doing. In that
and then
start.
what you have is like you have more than 60,000 people, civilians taking shelter. So you have to make sure that they have drinking water. A hospital that is not meant for more than 2,000 people. What happens to water and sanitation? What happens to hygiene? So all of this has to be looked at. So I can but not even imagine as the director of the hospital what you have to think about there.
Right. You were talking of your colleagues losing their families there. So that is what I was about to ask you next. Have any of the MSF your MSF colleagues there died, or their families, they have lost their families? Do we know that?
So in Gaza we have more than 300 staff that is there, and we have been able to maintain contact with the majority of them, and we have also been trying to facilitate the ones who wanted to go towards the south to seek some safety. So that means that our teams are dispersed across the Gaza.
North and south. And all of them are safe? I mean, to the extent that we can imagine in this conflict.
Absolutely. So what I can only confirm is that we have not heard anything that would make us believe. We are hoping that our teams stay safe as much as possible, and that's why we have been asking for an immediate ceasefire. We have been asking all the parties to respect health workers and allow them to do their job.
And their family members?
Some of them are missing, some of them are displaced. A week back, I spoke to one of the staff members who is a translator.
Okay.
And she had moved to the south along with her children, and was separated from her family. Her mother and husband were in a different location, but she knew that they were safe. And I asked her, how does a day look like for you in Gaza in such a situation? She's like, I'm just turning and tossing in my bed, just hoping that there's not a bomb that lands near to me. Then I wake up in the morning, I just run to look at the generator if there is sufficient fuel. Then I go and look for supplies to see if there is sufficient food to feed my children. Then I go and try to see if I can get in touch with my family. There is no electricity. I cannot recharge my phone. The internet system is broken. Almost certain parts of Gaza, you cannot have access to internet. So relying on a radio, and sometimes there is also a complete blackout, communication blackout, and we have seen it a couple of times so far. And just imagine the chaos that it would create.
So other than the people who belong to Gaza and they are working for you, you have people of 15 more nationalities volunteering there.
Until hardly 3 or 4 days back, we did negotiate because they were completely exhausted and they were not able to do anything.
So how are you functioning? I mean, are you like, are your volunteers working there for like a week or 5 days, and then you are replacing them with another set of volunteers? How are aid agencies and maybe an aid agency like MSF is functioning there?
So in an ideal environment, in an emergency context where there would be such a flare-up of conflict, we would make sure that we rotate our teams because it's non-stop working for 24/7. So we want to make sure that our teams are able to do their job without being exhausted. So in an ideal world, it would be every 4 weeks we would change the team. But because of all the entry points being closed, our teams are waiting to be kind of rotated. So what we have is like we are currently heavily relying on our Palestinian colleagues to do all the work. And that is why we are asking for an immediate ceasefire, a possibility of us bringing in more people, because there are people who are willing to come in and help, because there are needs are immense, but we can only be able to do it if we are allowed people, supplies and safety of our staff. So
basically you haven't been able to rotate your teams ever since the conflict started?
No, not the international teams, but that is where we are extremely concerned.
And international teams you have been able to rotate?
No.
So neither international teams nor local people of Gaza?
No. we have not been able to rotate our international teams. We did manage to bring the teams out, but our emergency teams that are waiting, standby at the Rafah border, they are not being allowed in.
Okay. And so you could bring the team out, but you couldn't send another team in.
Yes,
That's what
you're
you're
right.
saying.
Yeah.
And the local colleagues who are working there, they are already working there.
They are already working
non-stop.
there, non-stop.
So, I mean, it's difficult for me to even imagine the full scale of mental toll that every, worker, everyone who is working there with some or the other aid agency. If you have been talking to your colleagues at Gaza, what is your sense of the mental toll that they are, that they have had in these days and perhaps may have to suffer it in days to come?
I did allude to it a bit earlier, and they are not able to take a moment to kind of relieve themselves, to be able to say, okay, I'm going to take a break. Somebody else will come in, fill in my place. There is no space for that. That's one reality. The other reality is it doesn't stop. So what you have is like the flow is so continuous that you do not get a moment to think about. Your mental health is the last thing that comes to your mind. You're just thinking about survival, and that is what is happening there. The teams are struggling and trying to stay alive and stay afloat. And I think once this will start slowing down, and I hope there is an immediate ceasefire, I hope there is a humanitarian corridor, I hope that the world leaders really step up, I hope that the international community puts and exerts all its influence to ask for respect for hospitals, for health workers, because what we would then encounter is like a silent, invisible epidemic of mental health issues. That usually would be a part of post-conflict situations.
Right. Fuel availability has been a very, very major crisis in this entire conflict. It has affected everything and therefore the functioning of hospitals as well. What is your assessment of fuel availability right now for the hospital, especially where your teams are working?
As a medical humanitarian organization, our prime job is to do medical action. And to be able to do it, we need hands that are able to dispense that medicine and also the supplies that would help us go there.
How acute is the shortage of medicines? And if you could say, other than the trauma medicines, surgical equipments and the medicines required to heal those wounds, what is the quantum of the shortage, the types of medicines and equipment that are in shortage? If you could give details about that.
What we hear, I would try to narrate an account of one of our plastic surgeons who said that because there are no disinfectants available, so they're using methods which are the only methods that are left. When I talk about it, what does it mean? Is like very basic things. The surgical load is manifold. And that would mean whatever the supplies that are needed, from bandages to anything that is required for surgery is running extremely low, and is being used. How do I define it? Because it is almost cruel to talk about it. So we heard surgeons doing surgeries without anesthesia, and we heard that shortage of painkiller. And when the doctors would and the paramedical staff would go through the wards, the voices, the cries of the patients due to the pain, these are the basics you would have expected.
Biggest hurdle at this point in time to increase the quantity of aid that you or other humanitarian agencies provide?
I would classify them into 3 actions. Number 1, allow safe passages for our medical teams.
So when this was announced that they are announcing that the trucks to be in, so this was for a definite time period, and now that permission has been sort of withdrawn.
So it is extremely slow. So on a daily basis, what would happen is like there are different entry points to Gaza. So between 300 to 500 trucks of supplies would come in.
through all these
all these entry points on a
Okay.
daily basis. Since October 20 until the end of last week, we are talking about 2-digit numbers. So some 82 trucks until last week had only passed into Gaza.
Okay, so what you are saying is when this conflict was not going on, through the 3 entry points, more than 300 trucks would enter Gaza.
3 to 500 trucks.
3 to 500 trucks would enter Gaza to give this aid.
Absolutely.
But now that has been limited to less than 20.
So since October 20 until last week, there were only 82 to 87 trucks that had crossed this checkpoint.
Okay.
Only one checkpoint, and that's the only one entry point. So what we are asking for is like allow our teams to come in.
Can you please talk about a bit about the things or the materials that you have sent or you have been able to send till now as part of the humanitarian aid, because that will help us understand as to what are the things which are in shortage there. So if you could tell a bit about those things.
Because one of the key things that is happening on the ground is non-stop surgeries. And what we have is ready to go trauma kits, which we have managed to send in, which are good to go for more than 800 surgical interventions at any given point of time. A surgical trauma kit would contain all the necessary equipments, medicines, that are essential for doing a safe surgery. So that would be one. Then vital medicines that are used in the ER, including antibiotics. We are talking about non-communicable disease drugs for hypertensive diabetic patients. So these are some of the drugs that are in acute shortage that we have been managed to bring in the first lot.
Right. But you could do it just in the first lot. After that it has stopped.
So far, no. This is the only thing we have managed to get into the country.
Right. I believe, as some of your press releases also named Israel in its statements. So, can you recall when was it the last time that you had to name an elected government, as someone which was perpetrator of violence? When did you name a government in your last press release as perpetrator of the violence?
Instances where we have spoken out or bared witness range from Ukraine to what's happening in Yugoslavia, Rwanda, Chechnya, Rohingya, Syria.
So you named a government of a country in the statements, or as you're saying, you were a witness, rightly so.
Yeah.
So did you name the government, like here we are naming Israel, did you name the government of a country in any of those press statements? Did you feel the need to do so then, like you felt the need to do now?
As a medical humanitarian organization, our prime job is to act. And that is where our focus has been. But what we have seen is that in this case, we have seen a complete disregard for our patients, for our health facilities, for our health workers. And that is where we have chosen to bring in the testimonies from our field doctors, nurses, paramedical staff, frontline staff to talk about what they witnessed firsthand. And that's what we have done everywhere where we have chosen to speak out and able to call out on all the parties in the conflict to stop it and to implement an immediate ceasefire. That's what we have been trying to do. And now if you ask me, have there been moments where we have attributed it? It's one of those where we have done it. Sad reality is that healthcare facilities are continuously dragged onto the battleground. Since 2015, we have marked loss of 26 MSF staff.
In different conflicts.
In different contexts around the world. In one of the biggest single event, our trauma hospital in Kunduz, Afghanistan, I spoke about it, was destroyed in a US
airstrike. So I believe after that airstrike, there was a UN resolution not to attack the healthcare facilities. And we see that now that resolution has been thrown to dustbin.
Yeah, and then after that, it's been our work experience in Syria, where hospitals and clinics we support have been routinely bombed. We talk about Yemen, a war-torn place, ambulances have been under attack. Recently, I spoke about the Kherson region, which is the eastern Ukraine. We did have to evacuate twice in 1 year, same hospital. And that is because of the non-stop bombing of the hospital.
So, we are able to recount so many incidents in the past, I'm sure as aid agencies, you would be making a noise that the UN resolution is not being followed. Other aid agencies would also have been making this noise. Where did we go so blatantly wrong that we ignored all these voices and we are seeing a repeat and a very bad repeat of same attacks again in yet another conflict?
And Banjo, that is my biggest worry as a humanitarian worker, that whatever we are witnessing today is going to set the tone for future. And I am concerned that if we have blatant disregard for international humanitarian law, we are heading towards an era where there would be chaos. We are talking about some global order that should govern conflicts, that should govern the rules of the war.
So you believe that not only this is harming the people currently, but this can set a precedent for future also?
That is what is critical for the world leaders, international community to understand. If we are not able to stop, if we are not able to implement an immediate ceasefire, the world is going to lose hope on the very tenets of how to treat civilian population during conflicts. The guiding framework of international humanitarian law, it is put to test, and unfortunately to a very bad test at this stage. And we really urge everybody to come together.
Apart from the healthcare facilities suffering, healthcare workers suffering, what has perhaps gone almost extinct now there, the things like food and water. We keep hearing reports. So how acute, or what is your assessment of the shortage of food and drinkable water there? In one of our interviews, one of our guests told us, in fact this was a doctor from Gaza, that perhaps doctors or people there are bathing once in a week. So as per MSF's assessment, how acute is the shortage of food and water there?
We hear about very long queues for people to get access to bread. And while they are waiting in these queues, the risk of their safety, that is something that is imminent, because
so they may be bombed while they are
many bakeries have been bombed. That's what has been reported. I think what is important here is like people are resorting to drinking water from the well, and sometimes drinking water that is not clean, saline water. Their personal hygiene is suffering. Just imagine all the newborn babies from the mothers, all the young girls, what happens to their hygiene? What about the sanitary napkins? This is the basic thing that is not being even thought about. Where would young girls get access to that? So what are they using as alternates? We have no clue about it. And where, if it's when the order of evacuation was there from north to south of Gaza, it was not as if the south of Gaza had prepared facilities to receive 1.2 million people. So people were seeking refuge in any place they felt was a potential shelter. But these places are not equipped with washrooms, with showers, with sufficient water, drinking water, cleaning water to for basic shower, and latrines and so. So what we are heading towards is like a situation where we are also worried about potential outbreak of diseases. So we're talking about diseases here.
Again, I think this was said by one of the humanitarian agencies only, that Gaza has become graveyard for children. You also spoke about the death figures. Apart from death and apart from the injuries, the physical injuries that we are seeing right now that the children are having to go through, what are the long-term impacts that you fear these children would have to suffer whenever this conflict kind of subsides?
Maybe I start with something which has been very disturbing for me personally, and will give you an insight in what is the world we are heading towards. So in these 3 weeks, we discovered another acronym that has added to the list of when we would say somebody coming to the hospital, injured, wounded, dead, unidentified, and so. So we are receiving a category of patients as children who are wounded children, no surviving family. That is the new acronym. So we are receiving children in the hospital with no surviving family. Just imagine, there is a generation of orphans that is going to be there, and who would not have any family left. So some of them will survive. What happens to their protection? What happens to their safety? What happens to their well-being? These are the things that will stare everybody, the world community, to look at, that you will have such people that you will have to find solutions. We will have to find solutions. So that's one aspect of I just wanted to highlight that unfortunately what this context has given us is another acronym adding to the innumerable words that have added to describe the catastrophic situation what we have on the ground.
Right. So, to kind of sum up this conversation, is it like, we are in middle of a tsunami, but the real impact that the tsunami caused perhaps would be able to gauge once the incident is over. So, are we seeing the impacts right now?
The only difference is this tsunami is not stopping. Imagine a tsunami and you have, the water is not receding. What does it mean? That is what I would kind of say that would describe what Gaza is this time. So what you are experiencing is like, there is no pause, there is no break from last 1 month of what is happening there. So for us to see what is the long-term impact, it's a long way to go. We're talking about today. At least when there is an earthquake, what you do is like you have a moment to go around and look for dead, look for injured, look for places to establish field hospitals. Here in this case, we are not able to do any of those.